When you imagine a pharmacist, what do you think of? You may think of a community pharmacist filling prescriptions, or you may think of a hospital pharmacist making medications to be given to patients in the hospital. While pharmacists do perform these roles, they also do much, much more. In 1997, the Accreditation Council for Pharmacy Education started transitioning the Bachelor's of Pharmacy degree to a Doctor of Pharmacy degree. By 2003, the Doctor of Pharmacy was the entry-level degree for pharmacists. This required pharmacy schools to offer clinical rotations during the final year of the pharmacy program. Pharmacists have continued to prove their worth in many different settings. One area that is growing is ambulatory care. Here, pharmacists work closely with other healthcare professionals to ensure patients are getting the most out of their medications. They are optimizing doses, monitoring for side effects, and much, much more. Let's hear what some pharmacists are doing in their practices to help patients and optimize their medical care.
We're right there in the clinic, working with physicians, physician assistants, nurse practitioners, the nursing staff, and everybody else to take care of the patient.
For us, we're fortunate in our clinic. We're all about making the use of medications as best it can be for each individual patient that comes into our clinic.
For me, being a pharmacist means helping bridge gaps and keep patients safe. We're also arguably one of the most accessible members of the healthcare team. So having that outreach into the community, having the opportunity to talk one-on-one with patients can really help us provide the best quality and safe patient care.
Being a public servant and providing optimal care to patients regarding pharmacotherapy.
Your pharmacists are always a great resource to go and ask more of those questions. Is this medicine right for me? Regardless of where they are, especially if you have them in your doctor's office, they're a tremendous resource that sometimes we don't think about as patients.
All pharmacists have the knowledge and license to ensure safe medication use and ensure quality medication use.
I have the ability to work with their primary care providers and other people on their care team to medically manage their conditions. And my part is to manage their medications to make sure that we're optimizing the use of their medications.
What I'd like to tell people is when you add a pharmacist to a healthcare team, it takes good and makes it better. It takes better and makes it the best. So it's not that necessarily that anybody's doing a bad job when a pharmacist is not a part of the team, but I really think you get optimal therapy once you have a pharmacist that's working closely with the healthcare team.
So feel free to ask your doctor or the nurse or whoever you're seeing that day if there's a pharmacist and if you can speak to them.